Hi and welcome to another episode of the Nurses Hub. Now, thanks for clicking, and you may have just clicked because you saw boobs on the thumbnail. Now, you'll know a female, your grandmother, your sister, your partner, a dear friend. So there aren't copious pictures of boobs throughout this video, but by watching the video you might just save somebody who has boobs. You might just save their life. So before I actually get into the guts of the video, there's a thing going around Facebook saying that if you've got chest pain, cough and get yourself to the hospital. It doesn't work. Coughing has no impact on whether you live or die from a heart attack. I don't know why it's circulating Facebook. It doesn't work. They've done studies. It makes no impact. If you're looking at doing chest compressions on yourself, you actually have to compress your chest by a third in order for it to have an impact on your heart. Coughing doesn't do anything to keep your heart going. So what you can do, if you're experiencing chest pain, pain down your left arm, pain in your jaw, pain in your neck, if you've got pain in the middle of your back that's concerning, if you've got breast pain, if you're short of breath, if you are sweaty for no reason, I want you to get 2 aspirin and I want you to chew them up and swallow them and call an ambulance. So why are women so different with a heart attack? Why are women's symptoms so different? And the answer lies in the fact that we've got boobs. Now, they did in their studies of where all the nerves come from, and they looked at women's breasts, and the nerves can be differently distributed on the left side and the right side of the same person. Now, when you have a heart attack, and a heart attack is basically where the heart is being deprived of oxygen, so whether it's through a blockage or whether you've got a clot, whether you've got atherosclerosis. So atherosclerosis is where you've got plaque build-up on the inside of your arteries and it's narrowing the arteries, stopping the blood from getting through. And the heart has its own unique blood supply. It comes straight out of the aorta. So I'll start off by explaining how the blood moves through your body, and then you can see why it's so important to actually recognise these symptoms. So your blood starts off in your body and it comes up into the right side of your heart. And then the right side of your heart pumps it straight up to your lungs to get oxygenated. And from your lungs it tips back down into the left side of your heart, and then it gets pumped around your body. Now, the biggest blood vessel in your body is the aorta, and it runs from your neck all the way down to almost your legs. And so straight out of the aorta it tips into the coronary arteries, and these are the heart's very own blood supply. And these are really tiny, so anything that goes into the coronary arteries, whether it be a clot, whether it be some plaque build-up, is going to stop the heart from getting the blood and the oxygen that it needs. And so if you get a clot form somewhere, and the biggest problem with clots is the ones down in your legs. So they can travel. So if you spend a long time on a plane, or you have a long bus trip, or you're immobile or after surgery and you can't move around too much, you're at risk of getting what's called deep vein thrombosis. And your deep veins are in the calves of your leg. Now, if any of those clots move, they can travel up. Now, remember what I said, the blood goes from your body into the right side of your heart. Now, your heart's actually got some large openings, so those clots will keep moving through, and the clot will end up in your lungs, and that'll stop you from breathing. So it'll make you really short of breath. It'll give you chest pain that you might feel like you're having a heart attack, because parts of your lungs aren't getting oxygen. They're starting to die off. In the event that the clot actually starts in the left-hand side of your heart, perhaps you do have a bit of build-up of plaque. A lot of these things are silent, and you don't know that you've got them until, you know, you start feeling chest pain, or you start feeling short of breath when you're going for a walk. These clots can actually shoot up out of your heart into the rest of your body. Now, the first place it'll go is to the coronary arteries, and that can actually create a blockage, so the heart actually stops getting oxygen, and you'll start to get cell die-off in your heart. The other place these clots can go straight from the left side of your heart is up into your brain, and that's where you have a stroke. So this video is just about heart attacks, and particularly heart attacks in women. So when you get a blockage in your heart and your heart's being deprived of oxygen, it dumps a chemical called adenosine. Now, those of you who've done sports science will know ADP and ATP, adenosine diphosphate and adenosine triphosphate. Well, the adenosine is the chemical that the heart dumps trying to regulate itself. And what they've found is that for people where they've got a really fast heartbeat, they actually give them an injection of adenosine trying to slow down the heart rate. So this is the heart trying to protect itself. But when they give these people the adenosine injection, it actually creates chest pain. It's one of the side effects. And so because we've got boobs, because we've got differing nerve configurations coming out of our spine and into our arms and out of our ribs and up to our boobs, we get different messages. So the adenosine dumps around the heart, and the nerves that are in the chest cavity, it doesn't dump into a particular organ or into the blood vessels or anything like that. It dumps into the cavity, into the interstitial spaces. And the nerves that just happen to be in that area will pick up on this adenosine and tell the brain that there's pain somewhere in that area. And so women can experience different symptoms of pain just because we've got boobs and we've got all of these extra nerves. So I'm glad you haven't clicked away. I'm glad you're still watching, because the symptoms of women having a heart attack may be chest pain. They may get that radiating pain down the left arm. And do you know why it's the left arm and the left side of the jaw? The heart sits in the left-hand side of the chest cavity, and so that's where it's going to dump all the adenosine. So you can get jaw pain, you can get neck pain, you can get the classic chest pain. You might feel like an elephant is sitting on your stomach. You might get really sweaty for no particular reason. You might feel a bit fatigued. And this isn't just, you know, I'm tired because I've had a day. This is all the energy draining out of you. You might feel a pain between your shoulders in your back. You might feel short of breath. So these are the symptoms, and I'll just scroll them down the side there. And if you have any of these symptoms, or if you're at all concerned, I want you to either go to a hospital or go to your doctor. Call an ambulance. And if you know a woman who is experiencing any of these, please get them to medical attention before anything awful happens. So this is a quick video. I hope you can help the women in your life, and thanks for not clicking away because I didn't show a million boobs in the video. So this has been another Nurses Hub video. Thanks for watching.